The intensive care unit in this Buenos Aires hospital has been on the front lines of the fight against COVID-19. As patients here struggle to stay alive, doctors and nurses have become their main sources for comfort and support. Diego CARVAJAL, a nurse, tested positive for the virus. After recovering, he returned to the job he loves.
The reality is what we see here is this fight against death. We are making an effort so a person can recover, but sometimes it's difficult because their bodies are in a very bad shape. Many believe this is a joke and underestimate the virus, but this virus kills.
A few months ago, the hospital was forced to close this unit because of the number of infections among healthcare workers. Even though Argentina was one of the first countries in Latin America to impose a lockdown, the virus has continued to spread. But the quarantine was crucial to allow the health ministry to get ready for the worst. We're here in the intensive care unit in a public hospital in Buenos Aires, and what we're being told is that they built these walls, for example, in the past month, among other things, to protect the healthcare workers. This is the EVITA hospital in Buenos Aires, named after the wife of former President Juan Perón. Since March, the hospital has increased its ICU beds from 4 to 24. Javier Maroni runs the hospital and says the pandemic shows the importance of the public healthcare system when it comes to saving lives.
We have a profound sense of what public health means. We have policies that promote the right to health, and that makes us proud. There are more vaccines, there are more supplies, we have hired more people. There is a pandemic that is killing health workers, destroying families. We had the time to prepare, and that's crucial.
Argentina has been on lockdown for 6 months, but the government has been slowly opening up some sectors of the economy in an effort to save jobs, despite an infection rate that remains high in Greater Buenos Aires. The situation is different in other parts of the country. Reports indicate that COVID-19 is spreading to provinces that a few months ago had 0 cases. In the city of Orán, in northern Argentina, hospitals are also under strain.
I'll tell you the truth, this is hell. Stay at home, get bored, tire yourself out, enjoy your children, paint, do whatever you can, stay at home. 10 seconds out on the street is like having a loaded gun to your chest. It's preferable to bore yourself out at home than to come here and cry out, "God, don't take me," or to cry out for oxygen.
Early on, Argentina successfully managed to contain the spread of COVID-19. Now, authorities are hoping the healthcare system will be stable enough to cope with the uncertainty in the months ahead. Teresa, Al Jazeera, Buenos Aires.